Dental Office Emergency, Case Study Project, Hypoglycemic Episode by Anna Prida. My assistants were Anai and Mariella. The case study. The patient arrives for their appointment and state they have been fasting. The hygienist checks the patient's chart and finds they do not have a history of diabetes, and proceeds to clean their teeth. Towards the end of the appointment, the patient goes into insulin shock, caused by severe low blood sugar. Hi, how are you doing? I'm Anna, I'll be your hygienist today. Okay, so I'm going to go over your medical history, and then we're going to take your blood pressure and your pulse, and then we'll start your procedure, okay? Okay, so I see here that you have no health conditions, no diabetes, no asthma, and no medications.
No, but I am fasting. I've been fasting for a few weeks now.
Oh, you have?
Yeah.
How is it going?
It's going good. Some days I feel a little weak.
Okay.
Yeah.
Okay. So I'm going to take your blood pressure. Do you feel okay today?
Yeah, I guess so. A little weak, but I should be fine.
Okay. So your blood pressure is good. It's 120 over 70. So now I'm going to lay you back, and I'm going to put my gloves on and my mask, and then we will begin, okay? In real life, I will be wearing a mask. Are you doing okay?
Okay.
Towards the end of the appointment, my patient began to show signs and symptoms.
Are you okay? Okay, I'm gonna set you up, okay? Anna, can you give me the glycogen?
I meant to say sugar instead of glycogen.
I think it's because I'm fasting.
Yeah, I think so too. So I'm gonna give you some glycogen, okay? And you're gonna feel better, okay?
Okay.
You're open? Okay.
I placed 4
Thank you.
tablets of sugar in her mouth. During this time, I will be monitoring her vital signs.
Oh, I think
Do you
I'm
feel
feeling
better?
a little better.
Okay, so we're just gonna wait for a few minutes and then we'll continue on, okay?
Okay.
Hypoglycemic. Hypoglycemic is referred to as an insulin shock, which is severe hypoglycemia with a blood glucose level lower than 40 to 50 milligrams. Mild episodes of hypoglycemia and diabetes occur frequently. Severe hypoglycemia affects approximately 30% of diabetics. It usually occurs because of missed meal or irregular eating, consumption of alcoholic beverage, or increased exercise with adjusting insulin dosage. The brain is dependent on a continuous supply of glucose, so brain function is affected when glucose levels fall below a critical level. This condition may be mistaken for an acute central nervous system event, sepsis, or psychiatric disease. Hypoglycemic is one of the most common emergencies in a dental office setting. The signs and symptoms that the patient will be experiencing are confusion, seizures, coma, dizziness, weakness, syncope, headache, intense hunger, cold, clammy skin, profuse perspiration, and irritability or aggressive behavior. Preventive procedures. If patient states they have not eaten, ask when was the last time they ate. Be sure there is some type of sugar in the emergency kit or fridge, in case patient goes into insulin shock. Be aware of signs and symptoms. Make sure patient is feeling well throughout the procedure. One of the ways to determine a patient's blood glucose level is a glucometer. So, if the reading is below 50, it indicates the patient is experiencing hypoglycemia. If it is between 50 and 150 milligrams, then the patient's blood glucose level is normal. However, if it is above 150, it indicates the patient is experiencing hyperglycemic. Treatment. For a cautious patient who is suffering from hypoglycemia, we should provide 15 to 20 grams of some form of sugar, such as table sugar, soda, honey, candy, orange juice, or glucose tablets. Airways should be secured and monitor vital signs. A positive response should occur within 10 to 15 minutes. It is not necessary to refer to EMS. For an uncautious patient who cannot take an oral carbohydrate, we should give them glycogen, which we administer 1 milligram subcutaneously, intramuscularly, or intravenously. Repair. We should follow the repair steps when a patient is suffering from hypoglycemia. First, we should recognize signs and symptoms, then evaluate level of consciousness, position the patient upright, activate cabs of CPR. We should monitor their pulse and blood pressure. I. Implement appropriate emergency protocol for hypoglycemia. 15 to 20 grams of sugar should be administered. Monitor glucose level and vital signs. Administer of oxygen 4 to 6 liters per minute if the patient is having respiratory distress. And finally, refer to physician for evaluation.